Hi everyone, welcome back to my YouTube channel. Today I will be sharing with you CMS proposed rule for fiscal year 2023 skilled nursing facility prospective payment system. Let's jump right in. On April 11th of 2022, the Centers for Medicare and Medicaid Services or CMS issued a proposed rule that would update Medicare payment policies and rates for skilled nursing facilities under the Skilled Nursing Facility Prospective Payment System or SNF PPS for fiscal year 2023. In addition, the proposed rule includes proposals for the SNF Quality Reporting Program or QRP and the SNF Value-Based Program or VBP for fiscal year 2023 and future years. CMS is publishing this proposed rule consistent with the legal requirements to update Medicare payment policies for nursing homes on an annual basis. The key takeaways from this proposed rule are as follows. Fiscal year 2023 proposed updates to the SNF payment rates. CMS estimates that the aggregate impact of the payment policies in this proposed rule would result in a decrease of approximately $320 million in Medicare Part A payments to SNFs in fiscal year 2023 compared to fiscal year 2022. This estimate reflects a $1.4 billion increase from the 3.9% update to the payment rates, which is based on a 2.8% SNF market basket update plus a 1.5 percentage point market basket forecast error adjustment and less a 0.4 percentage point productivity adjustment, as well as a negative 4.6% or $1.7 billion decrease in the SNF PPS rates as a result of the proposed recalibrated parity adjustment. These impact figures do not incorporate the SNF value-based program or VBP deductions for certain SNFs that are estimated to be $186 million in fiscal year 2023. Proposed recalibration of the PDPM parity adjustment. On October 1, 2019, CMS implemented a new case mix classification model called the Patient-Driven Payment Model or PDPM under the SNF PPS. When finalizing PDPM, CMS also finalized that this new case mix classification model would be implemented in a budget-neutral manner, meaning that the transition to PDPM from the prior case mix classification model, which was the Resource Utilization Group version 4 or RUG 4, would not result in an increase or decrease in aggregate SNF spending. Since PDPM implementation, CMS's data analysis has shown an unintended increase in payments of approximately 5% or $1.7 billion in fiscal year 2020. As with past case mix classification model transitions, CMS has conducted the data analysis to recalibrate the parity adjustment in order to achieve budget neutrality under PDPM. However, CMS also acknowledges that the COVID-19 public health emergency could have affected the data used to perform these analyses. CMS therefore did not propose recalibrating the PDPM parity adjustment in the fiscal year 2022 SNF PPS proposed rule, but instead solicited comments from stakeholders on the parity adjustment and a potential methodology to account for the effects of the COVID-19 public health emergency without compromising the accuracy of the adjustment. After considering the stakeholder feedback received in the fiscal year 2022 SNF PPS rulemaking cycle to better account for the effects of the COVID-19 public health emergency in this proposed rule, CMS is proposing a recalibration of the PDPM parity adjustment using a combined methodology of a subset population that excludes those patients whose stays utilized a COVID-19 public health emergency related waiver or who were diagnosed with COVID-19 and control period data using months with low COVID-19 prevalence from fiscal year 2020 and fiscal year 2021. As a result of this methodology, CMS is proposing a parity adjustment that would reduce SNF spending by 4.6% or $1.7 billion in fiscal year 2023. Proposed permanent cap on wage index decreases. In order to mitigate instability in SNF PPS payments due to significant wage index decreases that may affect providers in any given year, CMS is proposing a permanent 5% cap on annual wage index decreases to smooth year-to-year changes in providers' wage index payments. Proposed changes in PDPM ICD-10 code mappings. PDPM utilizes International Classification of Diseases version 10 or ICD-10 codes in several ways, including to assign patients to clinical categories used for categorization under several PDPM components, specifically the physical therapy, occupational therapy, speech-language pathology, and non-therapy ancillary components. In response to stakeholder feedback and to improve consistency between the ICD-10 code mappings and current ICD-10 coding guidelines, CMS is proposing several changes to the PDPM ICD-10 code mappings. Request for information coding infection isolation. Under the SNF PPS, various patient characteristics are used to classify patients in Medicare-covered SNF stays into payment groups. One of these characteristics is if the patient is being isolated alone in a separate room due to an active infection. In order to be classified for infection isolation, a SNF resident must meet specific clinical criteria. In response to stakeholder feedback requesting to change some of the criteria to code infection isolation, CMS is soliciting comments on the degree to which the current criteria for coding infection isolation should be expanded to allow cohorted patients to be included and to ensure that the payment rate impact of infection isolation is consistent with the increase in relative costliness associated with these patients. Request for information on revising staffing requirements for long-term care facilities. In the proposed rule, CMS is seeking input on the effects of direct care staffing, nurses, aides, and other professionals' requirements to improve the long-term care requirements for participation and promote thoughtful, informed staffing plans and decisions within facilities to meet residents' needs, including maintaining or improving resident function and quality of life. Specifically, CMS is seeking input on establishing minimum staffing requirements for long-term care facilities. Skilled Nursing Facility Quality Reporting Program or SNF QRP update. The SNF QRP is a pay-for-reporting program. SNFs that do not meet reporting requirements are subject to a 2 percentage point reduction in their annual update. CMS is proposing to adopt one new measure for the SNF QRP. CMS is also proposing to revise the compliance date for certain SNF QRP requirements. In addition, CMS is proposing to revise regulation text that pertains to data submission requirements for the SNF QRP. Finally, CMS is seeking comment on 3 requests for information or RFI. Influenza vaccination coverage among healthcare personnel measure. CMS is proposing the adoption of a new process measure, the influenza vaccination coverage among healthcare personnel or HCP measure for the SNF quality reporting program beginning with the fiscal year 2025 SNF QRP. The proposed influenza vaccination coverage among HCP measure is a National Quality Forum endorsed process measure number 0431 developed by the Centers for Disease Control and Prevention or CDC to track influenza vaccination coverage among healthcare personnel in facilities such as SNFs. The measure reports on the percentage of healthcare personnel who receive an influenza vaccine anytime from when it first became available through March 31st of the following year. If adopted as proposed, SNFs will submit the measured data through the CDC National Healthcare Safety Network with an initial data submission period from October 1st, 2022 through March 31st, 2023. Revised compliance date for certain SNF QRP requirements. CMS is proposing to revise the compliance date for certain SNF quality reporting program reporting requirements, including the transfer of health information measures and certain standardized patient assessment data elements, including race, ethnicity, preferred language, health literacy, social isolation, to October 1st, 2023. Proposed revisions to the regulation text, Title 42, Part 413, Section 360. CMS is proposing to make certain revisions to regulation text to include a new paragraph to reflect all the data completion thresholds required for SNFs to meet the compliance threshold for the annual payment update. Request for information on SNF quality reporting program quality measures under consideration for future years. CMS is seeking input on two future measure concepts, including: first is the functional outcome measure that includes both self-care and mobility items, and the other one is a COVID-19 vaccination coverage measure that would assess whether SNF residents were up to date on their COVID-19 vaccine. Overarching principles for measuring equity and healthcare quality disparities across CMS quality programs RFI. CMS is committed to achieving equity in healthcare outcomes for their beneficiaries. In this RFI, CMS provides an update on the equity work that is occurring across CMS. Included are CMS's plan to expand their quality reporting programs to allow them to provide more actionable, comprehensive information on healthcare disparities, measuring healthcare disparities through quality measurement and reporting these results to providers, and providing an update on their methods and research around measure development and disparity reporting. In this RFI, CMS is requesting feedback from stakeholders on the development and inclusion of health equity quality measures for the SNF QRP. Inclusion of the CoreQ short stay discharge measure in a future SNF QRP program year RFI. Ensuring that patients and families are engaged as partners in their care can be an effective way to measure the quality of patient care. In this year's proposed rule, CMS is requesting stakeholder feedback on the inclusion of the CoreQ short stay discharge measure in the SNF QRP in future program years, including whether there are any challenges or impacts they should consider for a potential future proposal. The CoreQ survey instrument is used to assess the level of satisfaction among SNF patients. Skilled Nursing Facility Value-Based Purchasing or SNF VBP Program. The SNF VBP program rewards SNFs with incentive payments based on the quality of care they provide to Medicare beneficiaries as measured by performance on a single measure of hospital readmissions. All SNFs paid under Medicare's SNF PPS are included in the SNF VBP program. Proposed measure suppression and special scoring policies for the SNF VBP program. CMS proposes to suppress the skilled nursing facility 30-day all-cause readmission measure or SNF RM for the fiscal year 2023 SNF VBP program year because circumstances caused by the public health emergency for COVID-19 have significantly affected the measure and the ability to make fair national comparisons of SNF's performance scores. As part of a proposed special scoring policy for fiscal year 2023, CMS proposes to assign a performance score of 0 to all participating SNFs, irrespective of how they perform, using the previously finalized scoring methodology to mitigate the effect that public health emergency impacted measure results would otherwise have on SNF performance scores and incentive payment multipliers. CMS proposes to reduce the otherwise applicable federal per diem rate for each SNF by 2% and award SNF 60% of that withhold, resulting in a 1.2% payback to those SNFs. Finally, CMS is also proposing that those SNFs that do not meet the proposed case minimum for fiscal year 2023 will be excluded from the program for fiscal year 2023. The proposed special scoring policy would maintain compliance with the previously finalized payback percentage policy. Per statute, the SNF VBP program must withhold 2% of SNF Medicare Part A fee-for-service payment and redistribute 50 to 70% of the withhold to SNFs in the form of incentive payments. CMS finalized a 60% payback percentage in prior rulemaking. SNF VBP Program Expansion. Section 111 of Division CC of the Consolidated Appropriations Act of 2021 allows the Secretary to expand the SNF VBP program beyond its current use of a single all-cause hospital readmission measure and apply up to an additional 9 measures with respect to payments beginning in fiscal year 2023, which may include measures of functional status, patient safety, care coordination, or patient experience. Using this authority granted by the Consolidated Appropriations Act of 2021, CMS proposes the adoption of 3 new measures into the SNF VBP program, 2 claims-based measures and 1 payroll-based journal staffing measure. The measure proposals include the adoption of 3 new measures beginning with fiscal year 2026 and fiscal year 2027 SNF VBP program expansion years. Fiscal year 2026 program year. Adoption of the skilled nursing facility healthcare associated infections requiring hospitalization or SNF HAI and total nursing hours per resident day measures. SNF HAI is an outcome measure that assesses SNF performance on infection prevention and management. The total nursing hours per resident day is a structural measure that uses auditable electronic data to calculate total nursing hours per resident day. Fiscal year 2027 program year. Adoption of the Discharge to Community Post-Acute Care Measure for SNFs or DTC. The DTC is an outcome measure that assesses the rate of successful discharges to community from a SNF setting. Nursing home staff turnover measure. Through an RFI, CMS is seeking stakeholder input on implementation of a nursing home staff turnover measure in the SNF VBP program. This measure consists of the percent of total nurse staff that have left the SNF over the last year. Developed using data from CMS's payroll-based journal or PBJ system, the nursing home staff turnover measure includes annual turnover for total nurses, RNs, licensed practical/licensed vocational nurses or LPNs, and nurse aides. Payment RFIs in the fiscal year 2023 proposed rule. CMS is seeking stakeholder input via RFI on the following items. First is SNF VBP exchange function. Seeking input on whether to propose either a new functional form or a modified logistic exchange function. The exchange function converts performance scores into value-based incentive payments, and each one determines whether payments increase or decrease for the highest or lowest performers, respectively. Second on the list is validation. CMS is seeking input on the design of validation procedures as well as a potential implementation timeline. Health equity. CMS is seeking input on whether to incorporate adjustments related to health equity and how to best tie health equity outcomes to SNF payments. Proposed policies to accommodate the additional proposed measures. CMS proposes to adjust the SNF VBP scoring methodology to accommodate the additional measures by updating the SNF VBP program measure level scoring normalization policy beginning with the fiscal year 2026 program year. CMS proposes updating the achievement and improvement scoring formula such that SNFs could earn up to 10 points per measure for achievement and up to 9 points per measure for improvement to accomplish their goal of continuing to award SNF performance scores that range between 0 and 100 points. Under this proposal, all measures in the expanded SNF VBP program would be weighted equally. CMS also proposes to adjust the SNF VBP scoring methodology to accommodate the additional measures by adopting a case minimum policy beginning with the fiscal year 2023 SNF VBP program year that replaces the low volume adjustment policy for the SNF readmission measure. Also, by updating the scoring policy for SNFs without sufficient baseline period data beginning with the fiscal year 2026 SNF VBP program year, by adopting a measure minimum policy beginning with the fiscal year 2026 SNF VBP program year, and by removing the low volume adjustment or LVA policy from the SNF VBP program beginning with the fiscal year 2023 program year. Accountability of quality care and patient safety in long-term care facilities. SNFs and nursing facilities, hereafter referred to as long-term care facilities or LTCFs, are accountable to provide high-quality care and ensure patient safety, including protecting the well-being of clinical staff who provide care in these congregated settings. LTCFs must continue to adhere to evidence-based infection control practices and CMS's requirements for participation for LTCFs at Title 42 Code of Federal Regulation 483 Subpart B. Compliance with CMS's requirements is critical as nursing home residents are more susceptible to severe infection from COVID-19 due to their age, underlying health conditions, and congregated setting. CMS continues to work with its federal partners such as the CDC in supporting the nation's COVID-19 response across LTCFs, including providing surveillance data to strengthen local and national surveillance, monitor trends in infection rates, and provide actionable goals toward infection prevention efforts. Finally, CMS and its partners, including state governments, have helped LTCF secure personal protective equipment and expanded access to COVID-19 testing supplies and vaccines, among other initiatives to ensure patient safety and improve quality of care across more than 15,000 LTCFs. Hope you found this information useful. If you enjoyed this video, please consider subscribing to my channel. Thank you for joining me. Bye now.